Thank you very much. I have a short introduction in the morning. I'm Hans Oster. I come from the BFW in Mainz, Germany. And I want to show you something from our institute and from the special situation in Germany. Our institute exists, here you can see, nearly 50 years. But in 2 years we are existing 60 years. We started in 1966 and are an institute for blind and visually impaired people, and they are collectively trained with non-handicapped people in various therapy professions in our institute. And since 2009 we have special courses for hearing impaired people too. Not together with the blind or visually impaired people, but also in an inclusive setting with non-handicapped people. Our vocational training and occupational retraining are physiotherapists, certified masseur and baniotherapist, podiatrist, but not for blind people, but for visually impaired people or people with other handicaps, and discovering hands. Additional to this vocational training, we have qualifications, training and certificate courses, for example, lymphatic drainage, manual therapy, neurological treatment, PNF or BOBAT therapy, or BOBAT for children, kinesiotaping, tape bandaging, osteopathy, and like this. And subfield and adaptation qualifications matched on individual basis to maintaining and securing employment and increasing personal job opportunities. The classes and lectures are adapted to suit individual needs of blind and visually or hearing impaired people. Every rehabilitant, every handicapped student is provided with personalized technical tools matching his grade of handicap. Some examples for this are integrated voice output with screen readers, attached braille reading display device, special enlarging software like ZoomText or like this, and for hearing impaired people, simultaneous translation from speech to writing. The classes of practical subjects are held in small groups. We starting twice a year with courses in physiotherapy at April and this October. The classes are normally nearly 24 students, but they are only together in theoretical lessons. In classes of practical subjects are held in small groups consisting of 10 to 12 students maximum, and they are mixed with visually impaired or blind students and with non-handicapped students. Practical teaching lies in the responsibility of qualified teachers with long experience in therapy professions. The teachers are also pedagogically trained for working with the special needs of blind and visually, or in the other courses, hearing impaired students. Theoretical teaching is performed by lecturers of the University of Mainz, doctors and medical specialists. Practical implementation takes place via integrated internships in clinics, hospitals, or like this. And these are the same like the non-handicapped students have their internship too. This is not a special setting, this is the same hospital or the same clinic or rehabilitation clinic like everybody other physiotherapists are learning too. We have a lot of subjects for learning. This is not so visually oriented, more for touching like this. We place great importance on enhancing our students' social skills and offer a variety of support alongside the vocational training, like conflict resolution training, job application training, individual problem solving offers, convenient internships and jobs, participation in work, testing and qualification measure, or assistance for funding of training costs. The BFW Mainz offers 104 apartments because our students come from everywhere in Germany. The non-handicapped students come from near Wiesbaden, Frankfurt, or around our school or institute, but the handicapped students come all over Germany and stay in our apartments 3 years, for example, for learning physiotherapists in apartments, which are divided onto 5 buildings. We have a full board canteen integrated on the campus, and the city centers of Mainz. Mainz is located at the River Rhine. The other side is Wiesbaden, and Frankfurt is only 20 kilometers. We offer a future-oriented training in key therapy professions to blind and visually or hearing impaired people. An integrated training of blind, visually impaired and non-handicapped people promotes self-sufficiency and independence in preparation for the later employment. I make a shortcut for the special situation you find in Germany. It's a little bit different. And there we have a study, a not so old study from 2012. This is a stock check survey about healthcare professions training in European comparison. The lemma is Gesine. This is health professions in Europe. This is a study from the German Ministry for Education and Research and from the Martin Luther University in Halle and the Federal Institute for Employment. And there you can see, and that is not so easy to compare what we have a situation in Germany and what you have a situation in other European countries, and I will tell you why. This is the impossibility sometimes for comparing. This study is looking for therapy professions and healthcare professions in Austria, in Netherlands, in Great Britain, in France and in Germany. And you find in Germany 16 healthcare professions. One of these we are talking about today is the physiotherapist. These are the 3 therapy professions: physiotherapist, speech therapist and occupational therapist. And you have a lot of other healthcare professions in Germany. And many of these you find in other European countries too. When you see the green one, this exists in all these compared countries: nurse, midwife, orthodontist, dietitian, speech therapist. Sometimes they don't exist in every these compared countries, and sometimes you find this partly only in a further education training. In every country you have a different name from these therapy professions. And in some countries you have assistant qualification too. This is important because when you see what is the employment opportunity in Germany, this is important because we have no assistant qualifications in Germany for ergotherapy, for speech therapy and for physiotherapy. In France as well. In England you have assistant qualifications for these therapy professions. In the Netherlands you don't have to, and in Austria it's different. In speech therapy you have no assistant qualification, but in ergotherapy and physiotherapy you have this to find. Interesting for me is that you have some countries they have direct access to the patients. In Germany this is a school education, not a university education, and so you have no direct access to the patients. But in some countries where you find to become these jobs with a study, you have also no direct access, like in Austria. For these studies, they only have this in Great Britain and in the Netherlands. Okay, what is the difference in Germany to all of these countries in this study? we have educational access conditions are a school. And the qualification to a physiotherapist is a school too. This is and you have to successfully complete it as 10 years school education. This is the medium school. We have a lower school education 9 year, then you have the medium 10 year, and then the highest school education is 12 or in some countries 13 years. And for get a physiotherapist, you need only this medium qualification for 3 years school education, or a short 9-year school education and additional minimum 2 years training successfully completed. And very new is that we, since 4 years, we have two ways. We opened the law that is now possible to get physiotherapists on a school, a special school, and on a university. In the other countries here I compared, you have a general or specific university entrance qualification after usually 12 years of school, or university entrance examination or a credit procedure. Okay, this is short. You have in Germany 3 years on school or 3.5 years. This is a model that you can start up with the University of Applied Science with a 3.5-year study and getting the degree of a Bachelor of Science or Arts, and maybe can go later for a master's degree. In France and nearly the same in the other countries, it's 3 or 4 years in Great Britain and the Netherlands, for example. Okay, this now the specialty of Germany. We have a law. In totally, it is a 3-year theoretical and practical training. In 2,900 lessons, the students have to learn theoretical and practical training inside the school. And then you have in vocational colleges and practical training with patients in cooperating hospitals, rehabilitation clinic, or physicians' offices for 1,600 lessons. These are the 3 years school education for physiotherapists in Germany. And now, the vocational training and occupational retraining for blind and visually impaired physiotherapists is, you have there are three specific educational establishments or schools in Germany, one of which is the BFW in Mainz, where I come from. I said to you before, in 1966, vocational training for masseurs and baniotherapists began. In 1991, vocational training for physiotherapists began. From there on, 2 courses with about 24 participants take place annually. Usually 60% of them are visually impaired or blind students. The other 40% are non-handicapped students. They can join every other physiotherapy school in Germany, but this is an inclusive, integrated concept, what we are doing like 1966, and this is very important for us. The 3-year vocational training is carried out according to the German occupational regulations for the training of physiotherapists. Since approximately 4 years, we at the BFW Mainz also offer a graduate, I say to you, program Bachelor of Arts, which enables especially blind and visually impaired attendance to an academic degree. What is the way for visually impaired persons to get a place in the school of the physiotherapy education? Basically, there are 2 ways. The first is they get an application on the 330 regular schools for physiotherapy in Germany. We see every time that if students try to choose this way, this is very problematic, since it does not only determine the German vocational training regulations, but also takes place in facilities which are neither pedagogically nor technically appropriated equipped. Additionally, one has to pay for it normally personally. The second way is a vocational training or retraining in a special facility, for example the BFW Mainz. Here the founding bodies of the social insurance pay for the vocational training in context of an initial vocational training for early or birth blindness or visually impairment, or a vocational rehabilitation for late blindness or visually impairment. This is also the way the German vocational training regulates indicated. This is apart from the German law for the physiotherapy education in Germany, and there you can find a passage where you can read: to allow blind and visually extremely impaired the ability to acquire the occupational title masseur or balneotherapist without any restrictions. This is very important because the blind and visually impaired students get the same degree, they have the same opportunities for working later like the non-handicapped people. A specific vocational training for blind ones must be prerequisite. It can be assumed that the training for blind and visually impaired ones should take place at appropriate and equipped schools, and that blind and visually impaired employees will not take over those activities which they are not capable of due to their condition. These aspects apply also to the vocational training for blind and visually impaired physiotherapists. This is apart from the German law. You find content and theoretical lessons and like this inside, but a special part here, the regulation for blind and visually impaired people. Then we have some prerequisites for the vocational training for blind or visually impaired participants. The same conditions as for non-handicapped students apply. It is merely the visual function which constitutes the particularity. Otherwise, physical ability to exercise and occupation, motor skills and coordinating suitable, proper social and communicate competences. The examination of the above mentioned items take place in a one-week assessment at our institute. What are the contents of this assessment? For example, motoric skills and coordination testing. This assessment get everybody. These are assessments for the blind and visually impaired, for later students and for the non-handicapped too. Special exercises, particularly with the partner, massage and hands-on with the test person. The second item is theoretical tests, speech comprehension or writing comprehension. The third is orientation and mobility, evaluating how the applicant's competences are. The fourth is conversation, assessing of communication skills, performance and self-presentation. The next is check-up on ability to work with the computer, reading and writing options, learning to learn or visual function, observed lessons and conversations with the students. Usually a 6 months preliminary course takes place. This is before the actual vocational training, in order to prepare students for the vocational training for physiotherapists. The aims of these preliminary courses are improvement of training of blind and visually impaired ones. This is carried out by teaching theoretical, practical and social study contents. And this is also important because the duration of the vocational training, the contests of it, and the examinations for blind and visually impaired students are the same in Germany as for students without handicaps. So they need the pre-course sometimes. The further aims are reduction or elimination of restrictions and disadvantages with which blind or visually impaired people have to struggle. For example, difficulties in accessing information, altered imagination about the human body's anatomic movements and functional relations, for instance. The preliminary course lasts 6 months in full-time training. Under certain circumstances, a 1-year basic rehabilitation can take place before. Aims of this are schooling of basic blind techniques, for example, braille or computer applications. Other contents are the advancement and development of required key qualifications, communication skills, sense of responsibility, problem-solving capability, creativity, independence, performed efficiency, and willingness. Some content, theoretical content, they are learning too: anatomy, physiology, IT training, and some practical lessons. And the last is they have a first internship for the professional orientation. What's special, and then I come nearly to an end, what special facilities for an integrated training of blind, visually impaired and non-handicapped students we offer? Our teachers are trained especially for working with blind and visually impaired students. We have small classes in practical lessons, I said to you before, maximum 12 students, normally 6 students with handicap and 6 without handicap. Talking electrotherapy equipment or thermometers or watches. Palpable tape measures and protractors. Screen readers, board cameras. All handicapped students are provided with a notebook with software needed, portable braille line, magnification software like Zoom text, voice output, and so on, and a variety of palpable models. And last but not least, literature of the field written in braille, digital, or as audiobook or MP3. What is very interesting, and this is the last what I want to say to you, that the conditions for physiotherapists in Germany are very good. We are looking for, when the students leaving our institute, we look after half year, we look after 1 year, and we look after 2 years after the examination, if they are in work or not. And we have from different qualifications, we have details from our impaired students and from our not impaired students. And when you're looking for the physiotherapy, we have a 100% integrated group. This means that we have, after 2 years, every handicapped, blind or visually impaired student is working in the first employment market, and the non-handicapped too. In the massage it's a little bit different. There we have 100% with our students non-handicapped, and nearly 71% with our are handicapped. But this is not so. We know why, because we have a short qualification from masseur to physiotherapist, and this difference here between the visually impaired students, they are not working, they make a short way to this qualification. After this, we have an employment rate from 88% with our handicapped students, and overall we have 100% with the non-handicapped and 93% from our handicapped, blind and visually impaired students. They are working after 2 years in the first working market. Why is this like this? I think the training and education is individual and highly specialized for blind and impaired students. The training and examination is equal to that of non-handicapped students in Germany. This is very important. It is no different. They can work in the same setting like non-handicapped people. The financing is usually secured via social insurance. This is not so very cheap to hold all these things for 3 years of education for the special teachers and like this is not so very cheap. And this is secured via social insurances, employment agency, pension insurance, or like this. And this is the last item and very important, there is a high demand of physiotherapists in Germany, shortage of skilled professionals, and they show you a chart. Mainz is the capital of one of the 16 countries in Germany. This is Rhineland-Palatinate, and there the government, the ministry are looking in health professions what is the employment in these professions, and nurses, if you know nurses in your country, they come to Germany, it's no problem, they get a job everywhere. They have a very great problem to get people for working, and the physiotherapist is the second. Only in this country, this is not the biggest country in Germany, we have in 2010 nearly 900 physiotherapists they are looking for. And this grows more and more. They are looking what is in 2020, and then we are over 1,000 physiotherapists they are looking for. In ergotherapy, in massage, or podiatry. This is everything not so big problem. You get a job as physiotherapist everywhere in Germany this time, and this is a good situation for every physiotherapist, and it's a good situation for physiotherapists with impairment as well. Okay, thank you very much for your attention.
Thank you. It sounded very enthusiastic. Do we have any questions now?
Toni.
Okay. Okay, Jan has a question.
Onko kuinka paljon täysin sokeita näistä fysioterapiaopiskelijoista?
So my question is, do you have any figures on how many of these visually impaired physiotherapy students, how many of them are totally blind?
To my colleague, maybe she have an idea. The blind students are getting decrease. Yeah, no, decrease. These are not so a lot of students like maybe before 20 or 30 years, but I think 10 or 15%. And blind or visually impaired physiotherapists working in Germany are nearly 20,000. This is the number, nearly 20,000 physiotherapists blind or visually impaired are working. Because we have 3 institutes, and every year 75 new blind or visually impaired physiotherapists come to the market. Every year 75, and we have this latest number I hear was 20,000.
Okay, that sounds very great. Any more questions? Thoughts?
I have a question here.
Okay.
So this means that you don't have unemployed physiotherapists at all in Germany?
Nearly nothing. Only people they don't want to work.
Okay. Yeah.
Only people don't want to work are not. But maybe this, I'm not quite sure, this is a little problem in Germany. This is the question for getting money. This maybe in your countries, physiotherapists, because of these academic degrees, are earning more money than the physiotherapists in Germany. But this is, I don't know. I don't know what they get in Germany, but not in the other countries.
I don't know the reasons, but we have last year, 2013, we have 613 unemployed physiotherapists, and we have 5.5 million people, about a little bit over 10,000 physiotherapists, and 613 was without work last year. It's quite a big.
This is quite a big problem that the government in our country, in Rhineland-Palatinate, now makes an action plan how to get more physiotherapists and nurses. These are the two professions in healthcare professions having problems, and now we're sitting together in this ministry from this government and looking for an action plan to get more physiotherapists and more nurses.
Okay, we have one more question at least. Jussi.
Joo, joku voisi tulkata, että onko opetuskieli saksa ja pääseekö Euroopasta, muualta Euroopasta Saksaan opiskelemaan?
Okay, alright.
So, is the teaching language always German, or is it possible for students from other European countries to attend your courses?
No, the lessons, this is only in German language. This is a problem. Last year we go to India, to Pune. They want to establish a profession like medic massage or physiotherapy for blind people. We stay there 2 weeks and working together with the curricula for this special school for blind and visually impaired people in Pune near Mumbai. And this is, they want to come to art, and now they have to learn 8 months in Goethe Institute in Pune for the German language. This is unfortunately not possible to make this in other language.
Is there Is there any future plans or thoughts that you would start English courses or education?
I take this question back to Germany. We discuss this. Why not? Europe goes more and more together, and this is a question we have to discuss.